I will be presenting the skill of administering eardrops to a patient. So my first step would be to go to the med cart, check the MAR, and make sure that I am pulling the right medication, right dose for that specific patient, reading any instructions on the eardrops, whether they go in the client's left or right ear or both ears, and make sure to administer to the correct place. So I would wash my hands, knock on the client's door, and identify them as well as myself, explain the procedure that's about to happen, ask for permission. I would provide the client's privacy by pulling the curtain and shutting the door. Before I give the medication, I can warm it between my hands through the bottle. And you just do that gently. It makes it more comfortable for the client if it's warm rather than cold, or even at room temperature when they're dropped into a warm ear. The client may pull away if they're cold or because it's uncomfortable, and you don't want that to happen. So I would check the MAR for the order and timing of the drops and give the medications in correct order at the correct time interval. So select the correct ear as directed on the MAR, whether it be left, right, both. And then I would possibly get assistance if it's necessary to prevent any injury, depending on the client, whether it's a child or a patient with dementia or Alzheimer's. You could have a more difficult time, so it would just be safer to have an assistant, another med aid, nurse, whatever it may be, someone that's able to be there with you and assist you if needed to prevent injury. So I would assist the client to sit or lie down in a comfortable position, with the ear needing the drops pointing up. So if the client's left ear needs the drops, then I would have them lay on their right side with this ear pointing up. They can also tip their head to the side, allowing you easy access. I put my gloves on. Gently clean the ear if needed, using a warm wet cloth and cleaning away any dry drainage or anything that's built up in the ear. The medication can enter the ear canal more easily if it's clean and there's no buildup or blockage. And it helps prevent the old drainage from being washed back in when you insert the eardrops into the ear. And you also never put a cotton tip swab, like a Q-tip, inside a patient's ear. You shouldn't put it in anyone's ear, but especially your patients, to clean their ears. Just use a wet washcloth, warm wet washcloth. Before administering the eardrops, like I said, you would warm them up because it's going to be more comfortable. So I would instruct my client to stay still while administering the drops, and I would straighten the ear canal, which allows the medication to get down into the ear, where it can have the most positive effect. So if my patient is a child, then I would gently pull the ear down and back, so that the eardrops can go down into the ear, and that's a child, an infant to 3 years old. And with an adult, you would pull the ear up and back so that they could fall down into their ear canal more easily. So I would drop the exact number of drops that are listed on the MAR into the ear, both ears, whatever it states on the MAR, allowing the drops to run down the side of the ear canal without the tip of the applicator touching the client's ear. Hair, hands, fingers, any of that, you want it to stay sterile. Gently press the ear closed for a few seconds so that the medication stays in and it doesn't run out. And ask your client to remain sitting or with their head tilted or on their side for just a minute or two so that you can have the best results and the medication can do what it's intended to do. If stated on the MAR, you can also place a loose piece of cotton, like a cotton ball, loosely in the ear after putting in the drops for about 15 to 20 minutes. Place it loosely, because if you pack it in the ear, it'll soak up the medicine and then the client will not receive the medication they were supposed to get. So replace and tighten the cap after you're finished. Store the medication according to agency policy and remove your gloves, discarding them for however the agency policy reads. Wash my hands and then go back to the med cart and the MAR and document that I gave the medication, or if there was a refusal. You also want to use a tissue to clean off the applicator before you close it back up, just in case, so it's clean and whatnot.